Welcome back. In today's video, we're going to talk about PMS and a very simple supplement that can help with some of these symptoms. So we're going to get right in today's content. So if you're one of those suffering out there with PMS or just hormone imbalance in general, this might be a very effective product for you. Let's take a look at some of the ingredients that are in here and what their benefits are. And I'll get into a couple of the clinical studies that we looked at to help develop this product. And so, if you are one of those sufferers out there with hormone imbalance or again PMS, I would encourage you to take a look at this product. So, here it is. Supplement support applications. So, something that we should just look at here for a brief moment is these ingredients are helping to maintain a healthy menstrual cycle. So, even if you're not necessarily have PMS symptoms, but just some irregularities. Again, the ingredients in here may be very helpful. There's three key ingredients. I'll get to those in just a minute. This product can also help promote progesterone and estrogen balance. So if you're someone that just has, if you're doing hormone testing, a saliva test, blood spot test, even serum blood testing, and those hormone levels are off, something that you can consider is what's in this product, which again, I will get to in just a moment. Supports prolactin levels. So this is something that we might always, typically associate with lactation, which of course it is used to help stimulate milk production after childbirth, but it also helps support fertility, and it also helps to support a natural or a normal menstrual cycle as well. The normal range is about 25 to 33 nanograms per mil. During pregnancy, you can see that level get above even 200. So, but again, in the context of what we're talking about today with PMS and hormone imbalance, we're just trying to normalize that level between this range of, again, between 5 and 23. So be aware of that. Having elevated prolactin levels outside of pregnancy can actually suppress LH, luteinizing hormone, and FSH, which can in turn disrupt normal ovulation. So that's why this is important, is we should be, if we have these PMS or hormone imbalance issues, I would encourage you to, again, have the actual hormone levels tested, but also dive a little bit deeper. Look at that prolactin level, look at that FSH and LH level to see if those have been skewed one way or another. And then it just promotes, this product helps promote healthy testosterone levels. And this could be for any age woman, really, essentially, past puberty, is the testosterone levels. We see a lot of low testosterone in women, especially postmenopausal women. And so we need to be aware of this issue and really assess this hormone. I mean, testosterone is important for bone health and heart health. There's a multitude of different aspects, of course, libido and so forth. But making sure that we have enough testosterone in our body in women is critically important. Now, for younger women, testosterone levels can be excessive, and that can lead to other issues. It's a contributing factor or an issue with essentially looking at women that have problems with PCOS, and so they could have elevated testosterone levels. Well, there's ingredients in this product that can help to minimize conversion of other hormones into testosterone. So we'll look at that also in just a quick moment here. So let's move on. What are these supplements that I'm talking about? There's three of them. There's chaste tree berry, there's licorice root extract, and then the last one here is white peony extract. So let's first look at chaste tree berry. What is this and why is it helpful for normalizing our menstrual cycle? So there's a clinical trial done. The MC stands for multi-center trial. It was double-blind, placebo-controlled trial. It was a smaller study, 162 patients aged 18 to 45. There was four groups. There was the placebo, there was an 8 milligram, a 20 milligram, and a 30 milligram. Long story short, it was the 20 milligram dose, that treatment arm, that had the most clinical significance in reducing symptoms of PMS. And so they looked at basically their severity assessment using these visual analog scales for symptoms, as it says here: irritability, mood alteration, anger, headaches, bloating, and breast fullness. And again, that 20 milligram was the most significant in reducing these symptoms compared to the 8 milligram and placebo. The 30 milligram had just as of a clinical effect, but essentially with the 30 milligram, there wasn't any clinical significance over the 20 milligrams. So again, using the correct dose, using the minimal dose is important in my opinion. And then side effect wise, this really wasn't highlighted, but it's interesting here just to briefly look at this. But there was the side effects. There was a 9% incident rate in side effects with the placebo group, which is interesting. 6% in the 8 milligram group, only 2% in the 20 milligram group, and 11% in the 30 milligram group. So, looking at just from the side effect standpoint, there was more higher rate of side effects in the 30 versus the 20. Something to keep in mind there. So licorice root and white peony. We talked about licorice root a week ago. Now this was deglycerized licorice root. I'm not going to get deep into that, but the point is this is licorice root that's not deglycerized. So there is a potential here that this can cause hypertension and potentially some cardiovascular issues. So I encourage you to talk to your doctor before starting any supplement, especially this licorice root supplement. But again, also monitoring blood pressure would be a prudent thing to do if you're going to start taking licorice root. It's really great to help with adrenal dysfunction, and so is white peony. So together, there's multiple trials that are looking at these two agents. One thing to bear in mind here, or to bring to the forefront about licorice root and white peony extracts, is that they should really be in a 1-to-1 ratio. There was a study, again, I'll show this in the references, that looked at these two extracts and what is the optimal ratio between the two, and it's really a 1-to-1 ratio. They really balance each other out like yin and yang here. But they're shown to help maintain normal DHEA levels. Here's that prolactin level again that we talked about with the chaste tree berry, and it helps to improve or normalize prostaglandin levels. Licorice root can be helpful in adrenal support. So if you are somebody that's stressed out, there's another added benefit there. Licorice root has been shown to, here's that, blocking the enzyme responsible for producing testosterone. Now, it's not a complete blockade. Let me preface this by saying that this is just a partial modulation of this enzyme to help lower the production of testosterone. So if you or somebody, again, measure your level first, see where you're at. If your testosterone's even the high end of normal, and we have oily skin, acne, other symptoms that maybe we have a possibility of having PCOS or some of these other like insulin resistant issues and high testosterone levels, this licorice root might be something that could be helpful for you. And as I said, this 1-to-1 ratio is really important to understand and take it in that regard. So I would encourage you, if you want to look at purchasing these 3 supplements, we have a product on our Shopify account. If you're interested in purchasing these 3 supplements, we have a product here on our website. It's mdcustomrx.shop, and you can search the product. It's called FEM Support, FEMME Support, and it has these 3 ingredients in there. So, right, it's got the 200 milligrams of licorice root paired with 200 milligrams of the white peony. And as you probably would have guessed, if you listened to the first study that we talked about on the chaste tree berry, it's got 20 milligrams of that chaste tree berry to help normalize out hormone levels and PMS symptoms. So, and if you are interested in actually paying us a visit, we are in Brookfield, Wisconsin. Yes, we are a brick and mortar pharmacy. Please stop by. We'd love to meet you. And follow us on Facebook, Instagram, and YouTube. If you haven't already subscribed to our channel, I encourage you to do so. And here's our contact information. I'll leave that up here for just a moment. Thanks again.